Thank you very much for inviting me to speak with you guys today. We're going to talk about some pulmonary-related care complications, including influenza and some airway emergencies. So some of my objectives today will be to help you guys identify symptoms of an influenza illness, describe some management options of an influenza illness, recognize some airway emergencies, and understand the management options during an airway emergency. So first I'll start off by talking about influenza. And if this is what you think, as a parent of someone or somebody living with Duchenne, you probably got it right, but that's why we're here to sort of talk about what we can do. So I wanted to start off by kind of defining influenza, because you hear a lot of people talking about the flu, and what I'm talking about today is more influenza itself, which is a contagious respiratory virus caused by, or contagious respiratory illness caused by influenza viruses. The virus is spread from person to person by respiratory droplets, so if somebody coughs or sneezes, you can be exposed to it. There's an incubation period for viruses, so in the case of influenza, it takes about 2 days from the time you are exposed, but anywhere from 1 to 4 days before you would actually show symptoms. And then there's something called an infectious period, so how long can you actually transmit that infection to somebody else? And that can start a whole day before you even know you have any symptoms, and can really go on for about a week after you've become sick. So what are the symptoms of influenza? Typically, you see things like fever, cough, sore throat, a runny or a stuffy nose, maybe some body aches, headaches, chills, fatigue. Uncommonly do you see vomiting and diarrhea. A lot of people talk about the flu in the terms of the stomach flu, vomiting and diarrhea. This is something different. This is the respiratory influenza virus. And a lot of these symptoms are very common, no matter if you have any type of respiratory illness. So the ones we typically see when we're thinking influenza itself, and when we have a high suspicion, is when you really come in with these high fevers, you're coughing. Oftentimes it can start off as a dry cough. You've got a lot of body aches and headaches. It's important to recognize influenza and to have a heightened awareness, because young children, elderly, and then people with some forms of chronic illness, particularly muscular dystrophy and Duchenne's muscular dystrophy, are at increased risk of severe illnesses and complications from their influenza illness. And severe illnesses can lead to hospitalizations and even worse outcomes, so we want to be on top of it. Other symptoms just to look out for, more the emergency type symptoms in influenza that would trigger us to think more closely about some of these severe complications. In children can be fast or difficulty breathing, maybe a bluish skin color, we call that cyanosis. If they're not drinking enough fluids, not urinating enough, and you're worried that they're becoming dehydrated, if they're not waking up, or they're super groggy, not really interacting with you, or if they're so irritable that they really don't want to be held, or they're very difficult to console. In adults, they can have that same kind of shortness of breath or difficulty breathing. You may feel pain or pressure in your chest or abdomen. You could be feeling dizzy, confused. You may have a lot of severe or persistent vomiting. These are all really important symptoms to look out for. Another thing to be concerned about is if you have the initial flu-like symptoms that improve, but then a day or two, a few days later, they sort of come back, and now you've got a fever and a worsening cough. This may clue us into you having a more significant problem. So what happens with severe influenza illnesses in that scenario where your symptoms get better and now all of a sudden you have a new fever and a cough? We're really worried about pneumonia. And I know you guys have probably heard this a lot from your care teams. You've probably read a lot about it. You know, pneumonia can be a pretty big deal when you have a muscle weakness and an inability to, really clear that infection from your lungs. The other issue with severe influenza illnesses, you can worsen your underlying lung disease and have more breathing problems, which can lead to respiratory failure. So it could require stays in the hospital. It could require needing to use BiPAP or more BiPAP, or needing more aggressive modes of breathing support. And it can also worsen your underlying heart problems or any underlying heart failure. So I'm going to just use, for people in the audience who are a little bit more graphic, I just want to show you what pneumonia kind of looks like, because it may be able to help you wrap your head around how significant an illness can become. So this picture here is of a teenage gentleman. I'll sort of walk through a little bit of it. And this is, in general, a pretty normal x-ray in terms of looking for pneumonia. So this down the center here is the airway. This branches here and to the right and the left sides of your airway branches. All this structure around here is kind of the bony structure. So you see the ribs kind of coming across the screen horizontally. It's a little bit hard to see, but back here is the spine. These bright white lines here are actually rods from a spinal fusion. This area here is the heart. Your diaphragms are down here, and then your intestines and your stomach are down here. But let's focus in on the lungs. This kind of darker gray area are the lungs themselves, and the lungs, when you see black in the lungs, that means air. And so we want there to be air in the lungs as opposed to fluid or mucus. And so you see sort of this dark gray, almost black area in the lungs. And in general, that area looks pretty much the same, whether you look at the left side, whether you look at the right side. And so that's a pretty healthy appearance of the lungs. Now somebody comes in, they have a fever, they have a cough, they're breathing more difficult, maybe their oxygen levels are low, and all of a sudden you get this picture. And so fortunately, in the example I have here today, this person, fortunately, the right side of their lungs stays pretty healthy, which is not always the case. But you can start to see before where you saw sort of the heart border, you're now starting to see more white, and even up here it's starting to get a little bit more of a whiter shade of gray. And so this is a pretty classic finding of pneumonia on a chest x-ray. I'm going to move that image over to the left side now, and then in spite of doing aggressive treatments with antibiotics, with airway clearance treatments, maybe some breathing support, it's not uncommon, given the weakness and some of the inability to clear secretions, the pneumonia can get worse. And you can see in this particular patient, the whole entire left lung is affected. And so this is why we want to pay attention and not just kind of ignore these fevers or not just ignore a little bit of breathing, because this can happen pretty rapidly. And it can take a little bit of time to clear, and sometimes you need more aggressive things to clear it. So unfortunately, influenza can do this, but we have a lot of things that we can try to do to treat and help you guys out if this becomes an issue. And so before we get into what do we do in the acute setting of pneumonia, really one of the big things we can do is try and prevent pneumonia. So it's recommended that you get an influenza vaccine every year. This starts at the age of 6 months all the way into adulthood and elderly. And we also recommend anyone who's in the family or has a lot of close contact with you should also get an influenza vaccine. You can avoid close contact with sick people, and of course, common sense things like good hand washing. And then I'll put a plug in that you should follow your pulmonologist and your care team's recommendations for your respiratory treatments, even when you're well. If you can keep your lungs as healthy as they are at baseline, your reserve when you get sick should be a little bit better. When you have influenza, we always recommend a lot of supportive care. So you want to get good nutrition, you want to stay as hydrated as possible, you need sleep and rest to get better, and you want to do your aggressive respiratory treatments. And so I'm not going to go into specific, treatment routines or sick plans, because, individuals here should be working with their care teams to figure out what works best for you or your child, and, what order you're going to do things in, how frequently you're going to do things. But this is just a variety of things you can do. And in general, the things we're looking to do is mobilize mucus. So some patients have been prescribed things like vest, or parents and caregivers have been taught how to do chest physiotherapy. There's assisted coughing devices like the Cough Assist and the Vital Cough, but there's also ways you can manually assist somebody with coughing. Some individuals are trained in glossopharyngeal breathing. You may have suctioning at home. This can help clear some secretions. And then you may have some breathing or ventilation support, so BiPAP or mouthpiece ventilation, sip and puff, etc. And just a plug for making that sick plan with your care team, because it can really help in situations like this. As I mentioned at the start, influenza is a viral illness, so antibiotics are not going to treat the influenza infection per se. However, if you develop pneumonia or some other complicating bacterial infections, if the illness is lingering, it's not uncommon that we might use antibiotics in this situation. The other opportunity for treatment with influenza is actually antiviral drugs, and so there's about 3 of them out on the market now. They're given in various doses and various routes, oral, G-tube, IV. There's some age restrictions on certain ones of them, but these are out there now and are used pretty commonly. The benefit of antiviral drugs is that they can lessen your symptoms, they can decrease the duration of your illness by about 1 to 2 days, and they may be able to prevent some severe complications like pneumonia. They work best when taken within about 2 days of symptom onset. So if you've been around somebody who has influenza, or it really seems like a flu-like illness, you missed your flu shot, go ahead and call your provider early. And somebody though with muscular dystrophy, even if you've missed that 2-day window, we're likely to still recommend the antiviral drugs because you're at such a significantly increased risk of having some severe complications. And then we also recommend prescribing it to close contacts to be able to prevent influenza illness. So your little sister comes home, your dad comes home, somebody else has influenza, go ahead and get yourself some of the antiviral drugs as well in most situations. All right, so we're going to switch gears for the last few minutes here and just talk a little bit about airway emergencies. For anybody in the room who's learned CPR, we used to be taught ABCs. The American Heart Association may tell you it's CAB, but airway, breathing, circulation. I would argue in somebody with Duchenne muscular dystrophy, the airway is still one of the most critical things to think about in more of an acute situation. And so what is an airway emergency? In general, it's obstruction of your airway, obstruction of those breathing tubes. Most commonly, it's caused by mucus or secretions. Aspiration can create an airway emergency, so that's when you swallow something or inhale something and it goes down the wrong pipe and ends up in your airway. Or bronchospasm, which is more of a constriction of the airways, most commonly seen in asthma, but some people with Duchenne's also have asthma. And then also just talk a little about a difficult airway or a challenge to intubate or place a breathing tube and why people at Duchenne's are a little bit at some risk for that. So as I mentioned, obstruction of the airway, mucus is the most common cause of airway obstruction. It's very commonly to happen if you have an intercurrent illness. So you may be coughing more, you may have some increased secretions, you may start to feel some difficulty breathing. Sometimes we get a chest x-ray and you see some chest x-ray abnormalities. And the treatments are to really clear that mucus and unobstruct your airways. And so mobilize your secretions with the devices you've been given by your team. Help, use something to help cough out those secretions. Do some suctioning. And fortunately, uncommonly, but in severe situations in a hospital setting, sometimes we do have to go in and actually use our bronchoscopy equipment to be able to help suction out secretions for you. But I can pretty much guarantee you anyone on your care team is going to want to try and do anything and everything possible to avoid needing to take that next step. I also want to just throw in something here about obstruction of the airway when you have a tracheostomy tube. And so not everybody has one, but in this case, mucus is still the most common cause of an airway obstruction. The same sort of coughing and increased secretions. You may have thick secretions and maybe foul smelling. You would likely present with difficulty breathing. You may have lower oxygen saturations or changes in your skin color. And so it's really important in this artificial airway setting to still think about what you can do to unobstruct your airway. And so, in addition to doing the suctioning and mobilizing the mucus, one of the first things you don't ever want to forget is you can change that trach. There may be a big, thick mucus plug stuck in that trach. Get that trach changed, and hopefully you'll be able to breathe much more easily. And then if you are sick with an illness, you can work on mobilizing your secretions, doing additional breaths, and clearing those secretions. And then also just a plug for anybody in the room who does use a ventilator. Don't forget to check your ventilator connections, your power cords, your batteries. Make sure everything's working for you. Quickly, I want to just talk about foreign body aspiration. So if you have more of a sudden onset difficulty breathing, usually associated with choking or gagging while eating, we know there can be some loss of function and some weakness in the swallowing muscles, so this is a risk. You may have some noisy breathing, like a funny wheezing or inspiratory squeak or whistling sound. If it happens while you're at home and you can do one of your assisted coughing maneuvers to try and help clear it out, that's great. But it's not uncommon that you're going to need to seek some medical attention to find out where this foreign object went, and you may need a procedure to remove it, and you may need some more aggressive respiratory support to help recover. Bronchospasm, I mentioned, again, that constriction of the airway walls, and it's constriction of the muscle in those walls. It's more common in asthma. You end up with a decreased size of your airway openings. You can have some difficulty breathing, noisy breathing, and there are medications that asthmatics use, something called albuterol is most common, that can relax the airway muscles. So don't forget about that. If you're sick with a cold and you also have some asthma and your providers have given you an inhaler, that's something else you can consider trying to use. And I'll finish off a little bit here talking about the difficult airway. So people with muscular dystrophy can be difficult to intubate. Some risk factors: obesity can make it hard to see where the breathing tube would need to go in an acute situation. You may have some limited mouth opening. Your neck may be a little bit immobile. Your cervical spine, so the upper part of your spine, may have some deformities, and that can make it all challenging in an urgent situation or when you're just planning to go to the operating room for a planned procedure to intubate. And if you have a delay in intubation, you're at risk of having an injury to your voice box or airways. And then just a plug, if you are going to the operating room for any kind of procedure, don't forget to remind your anesthesiologist about your muscle precautions. So in summary, I just want to remind you that influenza is often a preventable illness, so get those flu shots, but it does have the potential to cause serious and life-threatening breathing and heart complications. Keep up with your home respiratory treatments and other recommendations from your care team, even when you're well. Create a sick plan with that medical team and know how and when to use it. And then be able to recognize signs and symptoms of emergency breathing problems and contact your medical team or seek a medical evaluation. So thank you guys very much.